Hello, my name is Vanessa Cornelius, and today we will be going over case study number 2. So, just as a refresher about my client for this course, he is a male that is 7 years old. His current diagnosis include autism spectrum disorder, global developmental delay, attention deficit hyperactivity disorder or ADHD, and avoidant or restrictive food intake disorder, also known as ARFID. The behavior we are going to focus on today is screaming. And then just to add on to the client's communication style, he is vocal verbal, and I thought it was important to mention that he had previously mastered PECS and then eventually began speech services and is able to fully communicate at this time verbally. So the behavior again is screaming. So the definition is any occurrence of the client making a high-pitched, non-functional vocalization above conversation level that can also be heard across the room. And then to track the frequency of it, a new occurrence begins after each breath. An example of this behavior is the client is working with his tutor and begins screaming without using words when presented with materials. A non-example of this behavior would be the client is presented with aversive stimuli and belts out no above conversation level. And so with this definition, examples, they are very similar, but the determining factor of an occurrence or non-occurrence is the use of words or not using words. So that is what you see there in the non-example, the client's using no, but at above conversation level, it does not meet the current definition of screaming behavior. So prior to the intervention, our client engaged in the challenging behavior of screaming for attention from others, so it's socially mediated, and then occasionally it would be for escape, particularly when his tutor would come into the center. The behavior had been reinforced by his parents and siblings, while periodically being reinforced by the RBTs when it was attention seeking. The intervention selected for this behavior was functional communication training paired with visual prompts. So our client was taught to functionally gain attention from others with having a visual prompt there to increase independence. So it was just pictures of the following: a person tapping peer's shoulder, the words "excuse me," taught to be used as either a PEC since he had previously mastered PECS training, or as a verbal response. Either or would have been accepted or is still accepted. And then in a group setting, raising the hand to gain attention was also one of those visual prompts. So whenever any of the above behaviors were presented, immediate access to attention was provided, and then in the beginning, access to the iPad, as it was the highest reinforcer, was provided just to reinforce that desired behavior early on. Continuing with the intervention, the RBT's behavior in response to challenging behavior screaming was also important to note here. So if the client engaged in screaming to gain attention, no reaction or attention should be given, and the RBTs were instructed to remain neutral. They also needed to wait for 5 seconds with a calm body and quiet voice from the client, and then moved on to prompt him to request attention by following the request attention goal outlined, utilizing the visuals previously mentioned. And then once the client appropriately gained attention, in the absence of the challenging behaviors, attention was immediately provided. Regarding the functional relevancy, the intervention was selected to decrease screaming behavior, increase independency, and then just to teach the functional communication across the board. Regarding the assessment, ABC data was collected by the RBTs, so we made sure that they informed us of the date and then the time, and then descriptively wrote out the antecedents, so what happened before, the behavior, what it looked like exactly, and then the consequence, how they responded to that behavior. And then moving forward, the BCBA had direct observation during both DTT and NET, while both RBTs worked with the client just to see if the behavior was consistent across people, which ultimately led to the hypothesized function of screaming being attention. I also wanted to note that the antecedent interventions are just important as the actual intervention. And so I wanted to discuss what the RBTs were informed of what to do just to mitigate and decrease that screaming behavior. Additionally, the stakeholders involved were also informed of these strategies. And so providing non-contingent reinforcement or attention throughout the day, modeling how to gain access to attention throughout the day, priming the client how to gain attention, especially during peer activities, always modeling functional communication, and then praising appropriate behaviors throughout the session, all to mitigate that screaming behavior and increase the likelihood of requesting attention appropriately. So by using differential reinforcement of alternative behavior, or DRA, we did have tangible access as a component at the onset of intervention just to increase the manding, and then we systematically faded it out. We wanted to start with a known item that was highly preferred to increase the manding, and then eventually the client became independent. In addition to the tangible access component, we utilized positive reinforcement, so gaining the desired attention, implemented with physical praise, which was tickles, as we knew this was really reinforcing for the client. And so those were provided when screaming behavior did not occur to gain the attention. Calm body and quiet voice was observed, which is objective. We made sure that if the client was stimming or had any sort of automatic reinforcing behavior interfering during the request for attention, we did allow that as it was socially appropriate. And then when attention was acquired appropriately, again, that was provided. Regarding the stimulus control, so the client's screaming behavior was ultimately controlled by attention and physical praise. So whenever attention was provided to the screaming behavior, the occurrence happened at higher frequencies, and that was due to the client learning that if he engaged in screaming, he would be able to have access to those desired response from other individuals. When planned ignoring was implemented, the ultimate decrease of screaming was present. However, there was an extinction burst at the onset of the intervention of planned ignoring in conjunction with the other interventions provided earlier in this PowerPoint. And then behavior skills training was completed with both of the RBTs and parents during a parent training to promote generalization and maintenance of the requesting attention functionally. The intervention and strategies we utilized to decrease the screaming behavior were evidence-based practices and is widely observed in the ABA community. And so differential reinforcement, research supports the effectiveness of it across multiple studies, showing its utility in reducing behaviors such as aggression or self-injury and screaming, anything under the maladaptive interfering behaviors that are not functionally equivalent, while promoting adaptive behaviors. And then I also wanted to provide a resource to read more about DRA as an evidence-based practice. So you can go ahead and click on that link, and it will provide you with a fact sheet with multiple resources to back up the information that was provided. Thank you, and I hope you have enjoyed this presentation.